Welcome back, my friends. Today on VetCrit, we're talking about the simultaneous administration of lactated Ringer solution, also known as LRS, and citrated blood products such as pet red cells, whole blood, and fresh frozen plasma. Imagine having a patient who needs simultaneous administration of a citrated blood product and LRS, but there is only one available peripheral catheter. Can you administer citrated donor blood or plasma and LRS at the same time? Conventionally, this practice is discouraged because LRS is a calcium-containing fluid that may be incompatible with citrate due to the risks of calcium chelation and clot formation. Once LRS exceeds the chelating capabilities of the citrate in the stored blood, that may result in clot formation, which makes perfect sense. However, as we all know, theory and practice are not the same in clinical veterinary medicine. Therefore, let's explore the evidence to answer this very practical question. The common recommendation to avoid simultaneous administration of LRS and citrated blood products is based on the paper published in 1975 by Ryden and Oberman in the Journal of Transfusion. They demonstrated that trace amounts of clot could be obtained from intravenous tubing at a whole blood to LRS volume ratio of 1:1 at room temperature. Fibrin clots were seen when the flow rate was slow at 60 drops per minute. In that study, gross clot formation was observed at a blood to LRS volume concentration of 1:5 at temperature of 37 Celsius. To achieve this ratio, a 10-kilo dog should be receiving LRS at a rate of 125 ml per hour and simultaneous blood transfusion at a rate of 25 ml per hour through the same catheter. In another paper, Cole and colleagues studied the compatibility of LRS and CPD-preserved pet red cells to evaluate the safety of using LRS as a diluent in the emergency setting. They found that there was no clot formation observed in the dilutions between 5:1 and 2:1 ratios of blood to LRS. However, some clotting occurred in ratios with high LRS percentage. Lorenzo and colleagues performed another experiment published in the American Journal of Surgery in 1998. They rapidly mixed whole blood and PEC cells with normal saline or LRS. These solutions were put through a filter, and the authors compared the infusion time, filter weight, and clot formation between the two solutions. This study demonstrated that LRS versus normal saline does not cause increased coagulation at a blood to crystalloid volume ratio of 1:1 during a blood transfusion at a rapid infusion rate. So, what are the main takeaways from all of that information? First of all, we should admit that simultaneous administration of LRS and citrated blood products may lead to clot formation, depending on the ratio and rate of administration. If you want to be on the safe side and avoid any additional risks of clot formation, then use normal saline at all times when simultaneous fluid and blood administration is required through the same catheter. Only rapid administration of blood products with simultaneous administration of LRS at much lower rates may be relatively safe. Ideally, the blood product administration rate should exceed LRS administration rate by at least a factor of 2 to 5. For example, if a 10-kilo dog is receiving citrated whole blood at 50 ml per hour, LRS administration rate should not exceed 25 ml per hour and ideally be even lower at 10 ml per hour if both solutions are going through the same catheter. Alright, if you'd like to download a free Excel-based calculator that allows veterinarians and veterinary technicians to assess the risk of possible citrate toxicity related to the donor blood administration, click on the link below located in the description section. And I'll see you next time, my friends.